All right, first I want to say thank you for everybody for jumping on today. I would much rather be at the YMCA looking at all of you guys instead of looking at a weird image of myself in the corner of my screen. Thanks, Abby. But nonetheless, we're all here today. So basically, for you guys who don't know me, my name is JJ Allen. I'm the owner and pharmacist of Sawyer Street Hometown Pharmacy in Oshkosh. I'm a doctor of pharmacy, certified sports nutritionist, and I work a lot with the community organizations, the YMCA being one of them. I think last year gave 5 or 6 different presentations, did some in-body screenings, and in our kind of goals and our missions are very similar. So we go very, very well together. But today I'm really going to focus on some of the misinformation, and a lot of you guys have sent me questions on this from the varying headlines that we see to support our own immune system. So there's really 2 big pieces that I'm going to talk about today. Number one, from a public health and a personal health standpoint, can't stress enough the importance of physical distancing. But then from there, then we have to ask, how can we support our own body's immune system? And a lot of the strategies that I'm going to be talking about today are low cost lifestyle strategies. And I'll be talking about where we can leverage dietary supplements, over-the-counter medications, and prescription medications when needed. But the main focus will be on lifestyle. This is weird, but I wish I could see your smiling faces. All right, so perfect. Okay, so before I start, I just want to, I think, take a moment for gratitude for what I've seen being done in the community in Oshkosh, and I'm sure all throughout Wisconsin and wherever you're at that you've seen being done of people giving back where they can, no matter how small or how big. And it's something that if you follow me on Facebook, my dog's name is Marcus Aurelius. I talk about meditations all the time, but this is a quote definitely to meditate on right now. And I know a lot of people are acting on this, which is even more important. And the quote is, the impediment to action advances action. What stands in the way becomes the way. The obstacle is the way. So right now, that obstacle we're all facing is SARS-CoV-2 and causing COVID-19. And we're changing our lives around it. And it has impacted people in a phenomenal number of ways, mostly negative. But what's coming through out of this is people are learning how to help each other. And it's motivating to me. It's motivating to my wife. I know we've given back more in these past 4 weeks than we have in a long time. And it's because of the awesome people that we work with every day. When we see Ken and Planet Perk, all that he's doing, we see the Oshkosh Area School District and Pastor John stopping by to get supplies all the time. It's just great to see everybody giving back. So keep that up. And yes, and we all can do our part. So keep that going where you can. All right. So the Oshkosh YMCA and Hometown Pharmacy. So I want to thank the Oshkosh Y for hosting this. Again, they do a ton of great things to give back to the community. They are definitely more than just a gym. They are a place that really helps people to dial in lifestyle changes and work as a community to improve health. So that's why we love partnering with them. And then for those who don't know much about Hometown Pharmacy, if you're not in Oshkosh and you're in Wisconsin, there's likely a Hometown Pharmacy close to you. So if you want to talk to somebody who is like-minded like me, one of my great colleagues, feel free to reach out to them. I know they'd be able to help you the same way that I can here. And with Hometown too, we're more than just a pharmacy. Something that I thrive on and love, and my colleagues do as well, is helping people to decrease the need for medications. So through lifestyle therapies and through targeted dietary supplements and nutrients where necessary, and using medications, of course, but using them very judiciously in ways to help improve our patients' health. So yeah, so thank you guys for all my colleagues. Thank you for everybody at the Y. I've talked a lot to various my staff who's doing an awesome job, and you guys are probably watching this, so make sure you get some work done. I know you guys can multitask, but I can't. and it's thanks to them that I can do things like this, because they are there serving patients in our pharmacy right now, and it gives me the opportunity to give back here and give you guys some lifestyle strategies. And then thanks to friend that I consult with, my first, my wife. She's a nurse practitioner. A lot of the things I discussed today are conversations we have every night. A friend, Sean Casey, a registered dietitian. He trains some awesome athletes, and it's humbled to be around him. Dr. Abby and all the other hometown pharmacists, Dr. Kathy, Dr. Mike T. Nelson, PhD in exercise physiology. There's just so many people that I am thankful for helping me through these things. So today, again, we're going to go over, and if you guys have questions, shoot them in. I've got, for some reason, the questions aren't coming up on my end, but Tyler, my colleague, will be shooting me questions and answering to them in the text chat, and I'll get to them at the end. But I had a lot of questions over the past few weeks, so I'm going to get to those first, and then we'll get to any questions that you guys have specifically as I go at the end. But kind of what the game plan is for the next hour, who knows, I got some time, is first we're just going to review physical distancing and the importance of this. And I know this is something that has really been hammered home is the importance of physical distancing, but we're going to re-go through it one more time. And then we're going to discuss specific lifestyle strategies. So you guys always hear sleep more, eat better, exercise more. Well, great, perfect. You tell me that all the time. So what I'm going to go through is some actionable strategies that you guys can take no matter where you're at to improve these three areas that can improve your immune system. And then we're going to discuss some of the conflicting headlines. So if you guys following the news, which I'm sure most people at home have more time to follow the news, there's a lot of conflicting headlines, whether it be medications, dietary supplements, over-the-counter products. I'm going to kind of help to tease through those headlines, and then as always, make sure you reach out to your local healthcare team before making any changes. And as we go through this, I'll talk about some strategic places you might want to consider a professional dietary supplement, and again, medications as well. As a pharmacist, that is my wheelhouse, dealing with the biochemistry of the body and optimizing that through nutraceuticals and pharmaceuticals. And one caveat before I get started, this presentation is for educational purposes only. Before making any changes to your medication regimen, to your dietary supplement regimen, to your regimen altogether, talk to your healthcare team. So if you're in Oshkosh, that might be me. Give me a call, shoot me a message. If you're not, that is going to be one of my colleagues. So get in touch with them. Things that I'm talking about today, again, are for educational purposes only. Cool. So this is kind of our outline for today. So this is, no matter if I'm talking about the immune system, no matter if I'm helping somebody with body composition who has sarcopenia, needs to build muscle, someone who has osteoporosis, looking to build bone, somebody has an autoimmune condition, somebody who just had a diagnosis of cancer. These are the places that we start. So I encourage everybody, if you have time, to get this book, excuse me, from one of my mentors, Dr. Thomas Williams. He is actually out of Stevens Point, but his book is a great primer for you guys looking to make specific lifestyle changes. We have these books at a lot of our hometown pharmacies. So if you're picking something up, reach out and see if you want to buy one of those. We can include that with your purchase as well. But something just to realize kind of our approach at Hometown Pharmacy to helping you guys lead healthier lives and be more resilient, be more anti-fragile. This is the framework. So number one is lifestyle. Number two is lifestyle. Number three is lifestyle. And number four is lifestyle. All right. So the big thing here is there's a lot of things that we want to do, whether it's a specific lifestyle modification. And again, each person's situation might be different. So when I'm making a recommendation here, it might not be appropriate for you. So always reach out to Hometown Pharmacist, and I'll talk about ways you can schedule consultations at the end. But before jumping to a medication, before jumping to a dietary supplement, we want to see how we can get these things through lifestyle. So this is what we'll really be focusing on. And then the second thing is the foundational dietary supplements. So dietary supplements can be used in two different ways. The first way is with the way most people think about them, as the term implies, supplement. So if I do a chronometer, or if I take a food log from somebody and I find gaps in their diet, the first thing I do is try to find ways with foods that we can fill in these gaps. A lot of times, due to dietary preference or convenience, this isn't always the case. So that's where we can add in dietary supplements to hit some gaps that people are missing in diet. But the second way to use dietary supplements is as a targeted dietary supplement. So this is using dietary supplements more like drugs, more like medications. So like you guys know, a prescription medication we cannot get from food. It's something that you need to take as a pill, as a capsule, as a tablet. And targeted dietary supplements are no different. The benefit of targeted dietary supplements, a lot of times when we use high doses of nutraceuticals to treat a certain condition, they have less side effects. So that's why I always look at targeted dietary supplements before going to prescription medications. And that's kind of our pharmacist framework as well. If we can use something with a lower side effect profile, but just as much efficacy before going to prescription medications, that's the place to go. Kind of an example of this is for myself. I am pre-hypertensive. I do a lot with lifestyle. I do a lot to fill in gaps with foods and some supplements. But for me, I take pretty high doses of magnesium glycinate, and I use beet powder. Now, could I eat beets every day? Sure, I could eat a whole mess of beets every day. Is that practical? No. The beet powder is a more convenient targeted dietary supplement. In the dose of magnesium I get, it would be pretty hard to get it from food. And if I did, I would be ingesting a lot of calories. So it's just something to think about. Food first, but dietary supplements can be good tools. All right. Cool. Abby says I got 65 people on. This is pretty cool. And I don't think I have a time cap. So I'm going to just make sure I get all this information out there, and then it will be available to you guys. But another thing, so when we go through this approach, a lot of people call myself and my colleagues, the pharmacists who don't like drugs, that I think is pretty darn cool. So I just want to, and just know, oh, I can use my mouse. Just know that this isn't something that I made up. A colleague and a mentor of mine, Jeff Robbins, had his patients call him this, and he said, I'm like, that's pretty cool. Then I had patients start calling me that. I know my colleagues have patients calling them that as well. But the big thing to get from this is that it's not that we don't like drugs. It's that in the traditional medical system, which is not bad or is not good, drugs are the first thing we go to. If you have disease X, we look at, okay, you have disease X, let's treat it with drug Y, which in some cases that's necessary. But in other cases, what we need to do first is look at a functional approach. That's where we look at lifestyle. So we want to make sure we make these modifications first and only go to the traditional therapies if needed. So it's not that either one of these is good or bad. There's tools from both worlds. And that's where really people at places like the YMCA, your hometown pharmacists, your doctors that are open-minded can help you guys navigate these two worlds to pull tools from both of them. All right. So I promise we're going to get to some specific immune stuff coming up here, but just want to lay some groundwork here. And so, some of the things I'm going to be talking about today, there's a lot of different steps that you can take. You might be doing a lot of these right now, or you might be doing none of these right now. An important thing to realize is take a few actionable items from this presentation and act on those. And then maybe next week, watch it again and act on a few different items. We want to strive for progress, not for perfection. It's something that we all can do things to improve where we're at for our metabolic health, for our immune health. But it's something that small steps are the way to go. We don't want to get overwhelmed. And if you want some accountability, if you want someone to guide you, organizations or local pharmacies. All right. Another very, very important thing is we want to be careful for simple stories. So last year, last year and a half, I think I gave probably 15 presentations all over the Fox Valley on specifically one dietary supplement. If this was an audience and I could see hands, I'd say, what have you guys seen signs for in stores for that is derived from hemp all over town? And I would see hands go up everywhere, and they say, hey, CBD. I said, yeah. So just know, and I don't want to harp on CBD, but just know, just like CBD is a tool, certain nutrients, certain drugs are tools that just because they're helpful for your neighbor does not necessarily mean they're going to be helpful for you. So this is why it's very important to talk to a healthcare professional before starting or stopping anything. And I recommend, I don't want to get on the CBD too much. I recommend CBD quite frequently to people having sleep issues, pain issues, because it's a lower risk alternative to a lot of the therapies that they're treating. But just know there's not one supplement or one thing that is perfect for everybody. So watch out for anybody selling you a simple story. Oh, and this is a, in the single cell, the biochemical processes. You guys are, we got the Krebs cycle in the middle. If anybody wants to draw me that in the comments, that would be great. All right. And then another important thing, to date, there are no known dietary supplements proven to prevent, treat, or cure COVID-19. If you see advertisements suggesting this or individuals making such claims, these should be disregarded. So again, dietary supplements, just like prescription medications, are good tools, but there is not a one-size-fits-all approach, and there is nothing right now. I don't care if it's drinking 5 gallons of tonic water and taking, don't do this, taking a whole bunch of zinc and then finding some chloroquine. Don't do any of these. But there's nothing right now for dietary supplements for COVID-19 that's specific. There is a lot of observational data and theoretical mechanisms that we can pull from previous studies. Now we can pull from what we're seeing right now, but a lot of it is theoretical. So again, we can look at what can we leverage that has a theoretical high benefit, but low risk. So we're going to talk about those here today. So number one, boom, boom, boom. I got my dogs in the audience, my actual dogs, Moby and Marcus. So they are sleeping. They are not entertained. But the most important thing I can tell you guys right now is physical distancing is still very, very, very important. So it's the number one thing that you can do for public health and your personal health right now is maintain wherever possible as much physical distancing as possible. And I like the term physical distancing better than social distancing because it's still important for us to be social. It's something that we know actually with our immune system is super, super important, that we're making connections with people. And I wish I could see you guys' faces right now. I just see my face, which is not fun. But using tools like Zoom, using tools like your cell phone, calling a loved one, using Facebook Messenger. I think my brother-in-law, smart guy, set up a 12 or 6-person Facebook group chat on Easter, and it was pretty cool and definitely not the same thing as seeing each other, but we were at least socially connected without being physically connected. But number one, for public health and personal health and to protect the loved ones that might be more vulnerable than you, physical distancing. So find ways where you can get the content that you would normally get, whether that's a presentation like today or getting fruits and vegetables from the store or prescriptions from the pharmacy. There should be no reason that if you are immunocompromised, if you're an older person, if you have comorbid conditions, that you need to go into a pharmacy to get anything. Call your pharmacy. There's tons of options to get prescription medications, to get dietary supplements, get over-the-counter products without having to go in. So they should be offering curbside pickup. They should be offering local delivery. And more important, if a pharmacy does not offer that, have a loved one that is either younger or has less of those comorbid conditions help you out and reach out to somebody to get those things. But there's a lot of ways that we can get done what we need without having that physical contact. So I do want to shout out to the Y. If you're not following them on Facebook, be sure to follow them. You will see our buddy Rich blasting on his thigh blaster, doing some hardcore abs. But now if you've watched that video, you'll know that Rich actually just uses body weight. But there's a lot of good tools that we can stay connected with the people that we love and we know in the community without being physically connected. So following these people on Facebook, following the Oshkosh YMCA, following other health organizations in the Oshkosh area, Art and Fitness, following Hometown Pharmacy on Facebook. And there's a lot of good videos that can get you guys some tools and tips to maintain physical activity, maintain a good diet, maintain social connection without being physically connected. All right. So this is also a very important thing. So I thought this slide was going to be next, but that's all right. I thought this slide was coming up. So this is a picture I took the other day at Menominee Park. So every morning for me, I make it a point to go outside and go for a walk. Basically, as soon as I get up, usually that's between 5:30 and 7:30 a.m. depending on the day. It was a little late today, but physical distancing does not mean physical distancing from nature. So the first tip I'm going to tell you guys is to help support your immune system. There's tons of benefits to getting outside. So if you're getting outside 0 times right now, I want you to get outside 1 time today. If you normally get outside 5 times a day, today I want you to get outside 6 times a day. Because again, social distancing, physical distancing does not mean distancing from nature. Unfortunately, some state parks are closed, so abide by those rules, but definitely get outside when you can and take in some nature. And there's some other benefits to morning sunlight that I'll be talking about here shortly. And pro tip, if you want to go outside and not risk running into anybody on the sidewalk, go outside at 6:30 in the morning. It's maybe me, Dr. Eric Smiltnik, my wife, not too many people out there, but it's beautiful. Okay. So this is kind of the framework. If you guys got the email 3 weeks ago or 2 weeks ago, I think, from the Wisconsin Department of Health Services, they talked about resilient Wisconsin. I saw this, I got excited. I was like, awesome. This is the next step. So the first most important thing that the health department needs to be communicating, which they are, is physical distancing. But then we need to be asking ourselves, what can we do to improve our immune systems? What can we do to improve our own health? And these are great tips from the Wisconsin Department of Health Services. So make sure you go on. The 3 we're going to focus on today is this first bullet. Again, so as you guys been in my presentation, I can talk forever, so I won't put you through this, but I'm going to get some actual items here quick. So that's good for you foods, a good night's sleep, a good amount of exercise every day. I'm going to show you some data on why these are important for immune health. But more important than that, a lot of you guys are probably rolling your eyes at me, which is fine, because you say, oh, JJ, you tell me this all the time. You tell me I need to exercise more, I need to sleep more, and I need to eat better. Fine, I'll try to do that. But then, but just telling people that doesn't make any difference. It's what actionable items can you do to, again, not perfection. I don't care if you're perfect, but take the right steps in the direction to improve those 3 facets of life. And those are the things I'm going to be talking about today, is actionable steps you guys can do to improve those 3 areas that we know are good for our immune system. So what do you say? Let's get started with some lifestyle. All right, I'm going to take a drink. All right, I'm going to start with a good night's sleep because these are some of the highest leverage and lowest barrier to entry change that I've seen myself, my patients, my clients make that really has improved their sleep. And by improving their sleep, we're improving melatonin production. We're improving our immune systems. So first thing, to get a good night's sleep, I'm actually going to go back to this slide. Beautiful picture. So the first thing to get a good night's sleep, if you're not doing this already, is going for a morning walk. So a lot of people ask me, well, JJ, you're telling me to get a good night's sleep, that you're talking about the morning. I sleep at night. What? So basically, the reason for this is the sunlight and light set our circadian rhythm, which is basically our body's ability to know when it's appropriate to be up and active and excited like I am right now. I wish there's more people here. And when it's time to calm down. So if we get outside in the morning and get exposed to the sunrise without sunglasses, and you don't need to stare at the sun, just get exposed to morning sunlight, that sets our body's circadian rhythm. It tells your body, okay, it's morning time. It's time to get up. Oh, my dog is barking a little bit. But so that is super important. Number 1, getting outside and getting some sunlight, setting your circadian rhythm. So then the second thing would be at bedtime. So in the morning, we want to increase blue light, and at nighttime, we want to decrease blue light. So it's something that at night, find ways where you can decrease blue light. So we're exposed to the screen that I'm looking at right now, our phones, TV. Hopefully we're not doing these things that much, but if we are, there's some tools that we can use to decrease blue light production and increase our body's melatonin production. So there's apps like Flux, which is an app on your computer, which you can set a timer on that will take out the blue light at nighttime. So when you're looking at the computer screen, the blue light is gone. You can also get some of these very, very attractive blue light blocker glasses. The ones I have are orange tinted. They block even more blue light. There are ones that aren't orange tinted. They don't block a ton of blue light. But again, we're looking for progress, not perfection. So having something that can help you block blue light at bedtime can be very, very impactful. And then the third thing is we want times of stress where we have very low stress. And then we want times where we exercise. I think for those of you guys who exercise, you guys know if you get out of your exercise routine, your sleep usually gets off because your body doesn't have that active stressor during the day. So we can have tools like following the Oshkosh YMCA, following our friends at Ardent Fitness, and watching their live virtual workouts. We get a social connection, and you get a workout in. Then the other thing we need to do is some sort of mindfulness practice. So meditation is a great way to include in mindfulness practice and a great way to lower stressors. So a free app, Headspace. Since I know all of you guys are on here watching me, I know you have the capability of downloading Headspace. There's lots of different apps for this. This is just one of the favorites from my staff and other patients that I work with. So Headspace is a tool for a guided meditation. And if you're a healthcare worker, I know they're offering their premium version for free right now. So be sure to check that out. Okay, so to improve sleep, morning sunlight. So take a walk, block blue light at bedtime, some sort of mindfulness practice, and some sort of exercise, whatever that means to you. And maybe that might just mean a walk in the morning, which is great. Again, looking for progress, not perfection. All right, and then, sorry, 11:38, but I'm going to, don't worry, we'll get through this. So, and if you're looking for more tools, again, these are just 3 easy, actionable tools that come up all the time that have been very high leverage tools for my patients. But there are still times when these might not get to the root cause of why your sleep quality or sleep quantity is poor. So looking at other tools is important. So setting up consultation with myself, one of my colleagues, or one of my favorite books from my buddy and my friends, Jody Nelson and her husband, Dr. Mike T. Nelson, Mr. Mole Goes to Sleep. It is actually a children's book. I think I should read it on here sometime to you guys, but it has some awesome nerdy advice for helping you guys to fall asleep and improve the quality of sleep. I just kind of want to hammer this point home. Someone say, okay, yeah, JJ, I know sleep's good for me, but we're talking about the immune system. We're not talking about, can I focus at work during the day? We're not talking about whether or not that I'm going to fall asleep when I'm driving. We're talking about how can I improve my immune system. So it's important to understand sleep plays a role in every single process in your body. And this is actually from a CDC training. I think it was a nurse's training. They look at sleep loss and its effects on our immune system. So just know if our sleep quality is poor, we're going to decrease natural killer cell function. We're going to increase inflammatory cytokines, which are basically the things that we're concerned about when people have the acute respiratory distress syndrome or ARDS, and decrease antibody production. So basically, if we're not sleeping properly, our immune system can get jacked up. So the first thing we want to look at is how can we improve sleep? And again, each person is very different, but there are a lot of tools. And then if those lifestyle tools didn't help, what do we say was the next thing? Right, you in the back said dietary supplements or nutraceuticals. So the next thing is dietary supplements and nutraceuticals can be helpful tools as well. And just know, along with sleep, specifically, again, this is observational data. This is correlation, a theoretical mechanism. But one of the theories on why kids are more resilient from SARS-CoV-2 and the severity of COVID-19 is because they have higher melatonin production than adults. And we know melatonin has potential therapeutic value to enhance immune function in age or older individuals. So again, we first need to ask, how can we improve our own body's production of melatonin? And these are through these light practices that I talked about. But then a tool we might use, and again, I'm talking about these tools first because we want to use these tools before going to medications. So I want to make the point that Benadryl, NyQuil, Zolpidem, these can all be tools that we might use to help to fall asleep and stay asleep, but just know that they may increase sleep quantity, but they're going to decrease, for the most part, sleep quality and have a whole other host of issues. So before jumping to drugs, we want to look at how can we support our body. So these is not necessarily that you need any of these or all of these, but these are tools that I commonly recommend for my patients. I just kind of want to drive home the thing with melatonin. So melatonin is definitely the place to start. There's a lot of other benefits to melatonin just besides falling asleep. Product that I personally like the best is Evolve Sleep. It's got some melatonin, some L-theanine, and some magnesium. But again, each person is different. You'll see CBD in the middle. So just one thing to know, the CBD companies always push CBD for insomnia. If you look at the data, the type of insomnia CBD works the best for is anxiety-related insomnia. So if it's something like I get some nights where I've got this monkey brain going, just thinking about things from the whole day, that's where CBD can be a helpful tool. So 10 to 30 milligrams of CBD before bedtime. Again, each person is very different, so make sure you talk to your pharmacist. Magnesium is also a favorite, and again, melatonin. So it's looking at dietary supplements after we've dialed in lifestyle and before we jump to medications. All right, so we got sleep dialed in, right? So we got some lifestyle changes. We got a good book to read. If you guys have questions on that, reach out to us. But then the next thing, supporting our immune system, is good for you foods. So everyone say, okay, yeah, JJ, I know, eat more fruits and vegetables. You're right. So we got a graph here. This is old, from 2014, and I stole this slide from Jeff Robbins, a colleague and mentor of mine. He is a great guy. But these are the most commonly consumed vegetables among U.S. consumers. And again, this is 2014. I should probably find newer data, but I don't think it's changed that much. If we look at the type of vegetables that we're eating, number 1 and 2, potatoes and tomatoes. So it's good. Potatoes and tomatoes they've got some benefits. But tomatoes got some lycopene, some other micronutrients. Potatoes, if you need a little more starch, carbohydrates, that's fine. But the issue is the forms that most of us are eating these in are forms like boom, French fries and ketchup. So I think something that is very important right now is supporting our local restaurants. We definitely want to do that. But just know they have options for salads and greens and stuff too. So making sure we're including some of those things is super, super important. And this is why a lot of people are having gaps in their diet, is we're not including these things. But we have another problem now, is with these fruits and vegetables, I just told you guys not to go in the grocery store. So how do we get them? And I'm going to be talking about this in just a second. But in a good tool to start, and ask your hometown pharmacist for this. The next time you go in for a curbside pickup, say, can you include the "What do we eat" handout? It's a good tool to go through your diet and see what micronutrients you might be missing. And again, these gaps are the first place we want to plug those holes, using food first and dietary supplements as needed to fortify our immune system, to fortify our metabolic reserve, to increase our anti-fragility so we can be the most awesome humans that we possibly can. So first actual item with food is ask for the "What do we eat" tool. Or if you want to get really specific, set up a consultation with myself or one of my colleagues. I'm about a month out with this issue right now, but then we get very specific, and I have you do food logs through Chronometer, and we get very, very specific on this. But going through your diet, and these are the things that most people are missing. So trying to get these things in are very important. I was going to start here. So again, most important thing, eat some fruits and vegetables. I really don't care which ones you eat. I know a lot of people have been specifically talking about green peppers having high amounts of vitamin C, and oranges having high amounts of vitamin C and things. And these are great, but just specifically, there's so many other phytonutrients and things in a wide variety of fruits and vegetables. So actionable item number 2 is Dr. Abby. I love when she says this, eat a vegetable. So basically, what that means is if you're eating 3 vegetables, let's increase that to 4. So let's add 1 vegetable to whatever your normal dietary intake is. And this can be super, super helpful. I don't want to stick on this too much because I want to focus back on immune health. But the other things most people are missing are omega-3 fatty acids. So one of my favorite is sardines. I can't find these anywhere right now. Very, very sad. Vitamin K2. So this is natto. Don't want to touch that too much. You need that. This is a beautiful liver. And then vitamin D, getting outside. My buddy Rhonda Patrick making one of my favorite green smoothies. If you guys like green smoothies, type in on Google Rhonda Patrick green smoothie, and she's got some great recipes. Okay. So after you go through your food log, you figure out what you need. Then we need to figure out how do we get that food. So JJ said, don't go in the grocery store if you don't have to, and don't. And I used to love every Sunday going on the grocery store and picking out my produce, going through the aisles. I haven't been in the grocery store, I don't think, in 35 days or more. I don't know. We started way before people told you not to go in the grocery store just because me and my wife are healthcare professionals. But there are ways to get these things without going to the grocery store. These are just a few of the places that I'm going and using. There's a lot of other places that you can definitely use as well. But our friends and their local business at Wagner Market is offering curbside pickup, and they're offering a grocery store concierge that actually go through and buy things for you. So that would be a tool you could use. Our friends at Freshie, and they are in Appleton here in the Fox Valley, are offering these essential baskets, which I got a picture of it here, which is a great way for you to get a variety of fruits and vegetables, and you can make a smoothie with this. I'm about to pick up, my buddy Michael is about to pick me up a box tomorrow and bring it to the pharmacy. So this is another way that you can get a wide variety of fruits and vegetables without having stepped foot in the store. Another tool is Instacart. A lot of stores utilize this. I know, I think we use through Aldi, and I think Festival, Pick and Save. So this is a application you can get on your phone that you can order groceries. It usually comes, it depends on where you're at, a day or two. We've only had to wait 2 days. But just know the people that are shopping for you are putting themselves at risk. They're going into these grocery stores. They're doing the same shopping you would be doing, and you're paying for this service. So I think an important thing is make sure you tip these people generously. These people need to be thanked just as much as healthcare workers are. They are hopefully younger, less immunocompromised people that are putting themselves at risk to help you get what you need. So if you're taking advantage of any of these services, make sure that you tell these people that you appreciate them and tip them well. The other thing is, there is my awesome team at Hometown Pharmacy. Again, I couldn't be here giving this presentation without them, but there are options too, not only picking up foods, but other items that you need. You should not need to go into a pharmacy if you need to buy Tylenol, or you need to buy vitamin C, or if at the end you say, okay, I think JJ said N-Acetyl Cysteine is probably a good thing, I should go to the pharmacy and buy that. And it might be a good tool for you, but the more important thing, remember, the number one thing that we said is physical distancing. So in order to get these things, there's other ways to get them. So the nice thing, I know all Hometown pharmacies are doing this, and a lot of other independent pharmacies are doing this as well. You can call us ahead of time and tell us what you need, and we'll get it all ready for you. Then when you get there, you call us and we bring it right out to your car, and we actually set in your back seat, so there's no need for physical contact at all. So there should be no need to go into a pharmacy to get anything. We should be able to do this all curbside or free delivery. Another important thing, I don't want to tangent on pharmacy things too much, but we've had a lot of people who've had delays in their mail order prescriptions. So if you're having issues with your mail order prescriptions, make sure that you reach out to your local pharmacy. They will be able to help you get this things right now and not have to wait a week for medication that you're out of. That is very, very important for your health. All right. So foods. Number one, we want to eat one vegetable. Increase your vegetable intake by one. And if you're a vegetarian, you're eating a lot of vegetables already. So your actionable item will be look at what you're missing. You're probably missing things that are in liver. So I'd say eat liver, but you're a vegetarian, so you don't want to eat liver. So it'd be looking at other ways, strategic ways to get micronutrients. Big ones for vegetarians, a lot of missing B12, iron, and a few other things. But looking for eat a vegetable first and foremost. And second, even more important, find ways that you can get what you need, the healthy items that you need with the least amount of physical contact as possible. And if you are a healthy person, reach out to your loved ones. If you have an older relative, if you have somebody who has comorbidities, if you have somebody who is has a less robust immune system than you, so you can help them out. And if you're utilizing any of these services, these people are putting themselves at risk, so tip generously. Okay, and I just want to drive home the point of why food is important when you look at immune function, and this is based on Dr. Bruce Ames' triage theory. So basically, if we have some micronutrients that aren't optimal but are okay, we're probably going to feel okay, but other processes that we can't feel aren't going to be optimized, like our immune system, like decreasing DNA breaks, increasing our risk for cancer down the road. So it's basically, again, this is just look at your diet. We want to make sure we're getting micronutrients, and specific ones we look at for immune system are vitamin A, vitamin C, vitamin D, vitamin E, B2, B6, B12. You guys can read that. I don't need to read that. And zinc. So these are ones that when I talk about dietary supplements, we look at the ones that people are missing the most. And the ones that come up the most often are vitamin D and zinc. These other ones come up as well, but these are the two to prioritize, the vitamin D and zinc. But then we want to look at the other ones as well, which I'll talk about. Okay, so I'm going to show a lot of pictures of dietary supplements right now. Just know that these are just tools, and I'm more showing these. So if you feel like there's something appropriate for you, that you can call and have a conversation with a pharmacist or staff member to see if the product is appropriate for you. But again, food first, and then we can leverage these professional dietary supplements. So the first one, we're looking to fill in gaps. Most people aren't getting enough vitamin D, omega-3s, and magnesium. So I got the big three here. And then a multivitamin can be important for some people. Again, diet first, but then once we fill in the gaps, and I'm going to talk about some of the data on these. So again, using these as therapeutics. So vitamin C at a little bit higher dose, zinc at a higher dose, copper, zinc lozenges. And doesn't mean you need to take all these or any of these. These are just things that I'm going to talk about as helpful tools. Vitamin D and dosing is really important on those. N-Acetyl Cysteine is something that I'm going to touch on. And then there's a lot of products that are specific for immune support. Again, don't need to take any of these or all of these, or you might be taking a few of these. Have a conversation with your pharmacist, look at lifestyle first and see what's appropriate. It is 11:54. I started a little late, and I'm going to, so I've got a lot of questions that I'm going to go through here for you guys. But the third one is exercise. And I'm going to leave this to people at the YMCA, my friends at our friends at the YMCA, friends at Art and Fitness. They can guide you guys better on this than I can. That is their wheelhouse. But increase or having some sort of physical activity, definitely beneficial to the immune system. When we look at exercise as a hormetic stress, so yes, exercise is a stressor to our body. And yes, in the right amount, exercise is a good stress. So this is not the time to be in a severe calorie deficit training for a bodybuilding competition, because that puts too much stress on our immune system. But it is definitely a time to get out and get active. And that might just mean taking a walk in the morning. If you had no activity before, take a walk in the morning. Or it might mean going on these online videos. Again, got my buddy Rich there, and doing those. So exercise, super, super important right now. Super important for stress resistance, our immunity, and my buddy Larry always talks about fueling our mitochondria. So exercise, super, super important. Okay, so we have the three big things. So we have actionable items for sleep, actionable items for nutrition, some actionable items for exercise. But now we're going to talk about some headlines. I think this is probably why most people are on here, to discuss some of the headlines that are coming up. So it's pretty confusing if you just follow the news and you follow the headlines. I think the most important thing that I can say right now, when I talk about all these caveats here, is no matter what headline you see, don't make any changes before talking to your healthcare team. Because again, a lot of these headlines that are coming out are based on observational data. They're based on epidemiological data. They're based on theoretical mechanisms. And a lot of the people making recommendations are making recommendations before we know if it's just a correlation or if there's a cause, if there's a cause there. So the first one that came on, a lot of my patients have asked me about, and I'm sure a lot of you guys have questions about, so just want to address it, is ACE inhibitors and angiotensin receptor blockers, or ARBs. So if you look at these two headlines, it's contradictory. So the first one says patients who take ACE inhibitors and ARBs may be at increased risk for severe COVID-19. Okay, so I should probably call my pharmacist and see if I should get off that medication. Then I look at this next one. Evidence suggests that ACE inhibitors and angiotensin receptor blockers may improve prognosis in COVID-19. All right, maybe I should call my pharmacist and ask if I should increase my dose. Like, what? So what do we do? So I think the most important thing, if you see these headlines, call your healthcare professional, call your pharmacist, have a conversation, don't make any changes. Because what we're finding with the ACE inhibitors is more correlative data. And there's actually some studies going on that they are using ACE inhibitors. These are blood pressure, I should clarify. So these are things like lisinopril, captopril, ramipril, losartan, candesartan, valsartan. So the tartans and the prils are ACE inhibitors and ARBs. So if you're on one of these medications, the important thing is continue taking these medications. It was first thought because these increase in our lungs, which called ACE2 expression, and the SARS-CoV-2 has been shown to enter cells through ACE2, that these medications may increase our risk for COVID-19. But further data came out and said, no, that's not right. And they're actually doing trials right now looking at starting losartan in patients with COVID-19 because they actually think there might be better outcomes with these medications. But the big takeaway here, do not start or stop taking any prescription medications without consulting with your healthcare team. So there's a lot of things that are changing in recommendations right now. But again, remember, it's important. We want to make sure we are managing our comorbidities. So if you have hypertension, it's important that we manage that hypertension. You may be managing with the medication, you might be managing with exercise, you might be managing with the supplement. We don't want to change any of those things unless a healthcare professional specifically tells you that. Cool. Excellent. The second one is NSAIDs. So this one is kind of near and dear to my heart because NSAIDs are drugs that I don't like very much at all. They're ones that if we can avoid using them, we should definitely avoid using them. But there was, I think, an overreaction to NSAIDs in some observational data in France. I think it was actually the French Minister of Health came out and said that she suggested ibuprofen in otherwise healthy people with confirmed COVID-19 symptoms were more likely to develop severe illness. So basically what that means is if you get SARS-CoV-2, you get COVID-19, you're more likely to have a worse outcome if you're taking an NSAID. But what's kind of been teased out more from this is people who take ibuprofen, people who take naproxen regularly, what do they have going on? They have more inflammation. So they have a higher underlying inflammation already. So the NSAID is not causing the problem, just like the ACE inhibitor is not causing the problem. It's the person's comorbidities that are causing the problem. And there is a theoretical risk with NSAID. So I do want to make the important point here that if you're having pain, if you're having inflammation, if you're barking like my dog is, hang on, sorry. If you're having pain, if you're having inflammation, there are other tools that we can leverage first. So the place I want to start first, and you guys probably can't hear my dogs as much as I can, so hope it's not bothering you, but I might let them outside here. But the place you want to start first is alternatives to the NSAIDs, Aleve, and Advil. So not only with SARS-CoV-2 is there a risk with Advil and Aleve, a lot of you guys who are probably older have doctors telling you not to take these anyway. The reason is they're very hard on the stomach. They have cardiovascular issues. They're hard on the kidneys, and less the better. And this is not telling you guys if you take an NSAID every day that you should stop. It's just something to have a conversation with your pharmacist, because depending on what you're using it for, there can be safer tools that can provide the same benefit but have a lower risk. Some of our favorites, and again, this is caveat depending on your situation, is decreasing your inflammatory status by increasing omega-3 fatty acids. This is looking at EPA and DHA. You see here, increasing magnesium intake if your issue is more muscle spasms. A lot of times magnesium, or for issues migraine headaches, increasing magnesium can be very helpful. If it's muscle spasms, there's good data with multiple sclerosis and muscle spasms that increasing CBD or cannabinoids is very, very helpful. And then Tylenol. So Tylenol is one where a lot of people are not quite as effective as NSAIDs, but if it is, it's something that's a lot safer. And one caveat with Tylenol, if you do have to take it frequently or every day, talk to your pharmacist about glutathione, because Tylenol does deplete glutathione. Curcumin can be another tool as well. So just know that if you're having pain, if you're having inflammation, there's other tools. And then if your goal is fever reduction, we really should look at Tylenol before looking at the NSAIDs. But again, if you're taking an NSAID and it's under your doctor's orders, don't stop it. Just have a conversation with your pharmacist or your doctor if there's some tools that can help the same with lower risk. All right. I think my dogs want to go for a walk pretty soon. He's looking at me. So we'll get there. And the cool thing is, since I don't have to set up like time for this, I'll be doing some more of these videos for you guys as well. So you can go back and watch these too. So if you guys have any questions, again, reach out to your hometown pharmacist, reach out to me. So the other one is vitamin D. So vitamin D is one that I recommend for almost everybody. So my team with Evolve Wellness, we make a product, vitamin D3 plus K2, that actually just came out the other day. And the reason is we're not getting out in the sunshine. So we're not making the vitamin D like we do in the summer. And most people are low on vitamin D. But a controversy came in when people looked at some papers that vitamin D, just like ACE inhibitors, increased ACE2 in the lungs. Remember, ACE2 is where SARS-CoV-2 can get into cells. So I remember coming home, I think it was a couple weeks ago, to my wife after work, and I just it was a long day at the pharmacy, and I just saw a flash come up on my computer from a PhD in nutrition I follow, Chris Masterjohn, that says stop taking vitamin D. Vitamin D increases ACE2 expression in the lungs, and theoretically it can lead to poor outcomes. So I said, oh shoot, I better go home and look this up. Before I go home, I asked my wife, I said, Evie, did you hear about vitamin D, the issues with it? She's like, no, not really. What are you talking about? I said the SARS-CoV-2 goes into the lungs and via ACE2 can possibly increase your likelihood of getting COVID-19 and maybe increase severe symptoms. And then she's like, you should probably look at what study that they're looking at. And they're looking at a mouse model study that basically showed that it can increase ACE2 in the lungs if you supplement with vitamin D, but it's not to an appreciable effect in humans. They actually tried to do it in humans again and did not have that same benefit. And more data is coming out showing that having optimal levels of vitamin D, so don't go to the pharmacy and get a crazy high dose, but most people are deficient. So supplementing vitamin D, just like we normally would, can be very, very helpful for improving our immune system, particularly looking at some of these papers here. The process seems to be essential for normal immune function, and therefore impaired or insufficient vitamin D level may lead to dysregulation of immune responses. So just know, if you look at papers and you look at headlines, a lot of these nutrients play a lot of different roles in the body. I think vitamin D controls, I think it's like a 1/24th of the human genome. So just because there's one mechanism that might potentially increase the risk for infection doesn't mean that there's other things that are more important with it. So we know if we're deficient in vitamin D, we're going to have a whole host of issues with osteoporosis, with depression. So I have a lot of patients who had low vitamin D levels and are on a SSRI or on an antidepressant. Once we get those vitamin D levels back up, we help them get them off the antidepressants, because vitamin D controls an enzyme called tryptophan hydroxylase that converts tryptophan to serotonin. Going on a tangent, but just know vitamin D does a whole host of things. So if we just look at it in isolation, it's something that we can come to conclusions that probably aren't warranted. So vitamin D, if you're taking it, definitely continue taking it. There's some groups pushing for even higher levels of saying, hey, take 40/60 isn't high blood level, but take 10,000 IUs a day. And I'm more on dose, again, educational purposes only, somewhere between 2,000 and 5,000 with some vitamin K2 seems to be sufficient. I want to thank my beautiful wife, Evie, nurse practitioner, for helping me sort through this. So vitamin D can definitely be a helpful tool. Get outside. Hey, I see somebody else than me, and she's much prettier. This is great. All right. So vitamin D sweet spot. Again, it's not time to get blood work done, but it's something that I encourage all my patients to get blood work done, just so we can see and dial in their vitamin D, because each person will respond to vitamin D supplementation very differently. In general, 1,000 IUs of vitamin D, raise your vitamin D level is about 5 points, or not 5 points, 5 nanograms per milliliter. So it's something that in general, most people I have taking between 2,000 and 5,000. Myself personally, I take 8,000. Again, talk to your pharmacist before making any changes. Okay, zinc is the other one. There's not much controversy here. The only controversy I would say is it's getting promoted like hydroxychloroquine and azithromycin. So if you watch any of the White House briefings, you see talk about hydroxychloroquine all the time. And there is conflicting evidence on that. And hydroxychloroquine carries risks associated with it. It's very, very important for a lot of my patients who have lupus, other autoimmune conditions. So do not go out and hoard hydroxychloroquine. Good thing is you can't without a prescription. Both your doctor isn't doing that for you either, because it's needed for other people. It might be helpful. And again, this is current as of Tuesday, April 14th, but the jury is still out on how helpful it is. But we do know that zinc, and again, zinc from food is important, but zinc at I'm using it as a therapeutic dose can definitely theoretically be helpful, because it's helpful for preventing other viruses. It's been shown to be potentially helpful for SARS-CoV-2. So to decrease the risks associated with hydroxychloroquine, so hopefully you're not taking it, but zinc can be a good tool to use. So first, getting a multivitamin, but next, looking at professional zinc products. These are all great options. My preference is the zinc lozenges or a zinc spray in addition to a zinc capsule. The reason is theoretically, if you coat your mouth with zinc, that if the virus happens to get in your mouth before you inhale it or swallow it, that the zinc itself coating the mouth and the throat could potentially inhibit some of the viral replication. But the big thing is if you're deficient in zinc, having some more zinc. So oysters is a big thing to get some zinc and some copper in, but we're probably not getting any oysters right now. So zinc supplementation, something to talk to your pharmacist about. There's actually some trials going on that they're using a protocol with hydroxychloroquine, azithromycin, and zinc with it. It's something to consider. Again, do not take crazy high doses. Talk to your pharmacist about the dose on it, because if you take too much zinc, you can deplete copper. So for people who are using higher dosage, so in the range of 60 to 100 milligrams, I always recommend some copper with it. So in a 15-to-1 ratio. So just a small dose of copper, and copper is pretty cheap. But so just know there's nuances with zinc. There's nuances with hydroxychloroquine. And I'm getting some messages, which is good. So let me just check my messages, make sure not, let's see, phones. All right. So I'm getting some messages, but I am going to finish this out and then get to these. All right. N-Acetyl Cysteine is the next thing. So this is something that has been, if you talk to me, has been a common recommendation that I've been making. And it's something that I wish I would have looked at the data N-Acetyl Cysteine sooner, because it's something that there's a lot of my patients that I'm going to reach back out to that it can definitely be beneficial for. So if you take Mucinex, or if you have lung congestion where you feel like you have mucus plugs, N-Acetyl Cysteine can be just as effective and actually more effective than Mucinex. Mucinex, or guaifenesin, is marketed to break up mucus, but it does not do a very good job of that. N-Acetyl Cysteine is a natural product. Well, it's amino acid that is even more effective at breaking up the mucus, and it's a precursor to glutathione, so something that we need as an antioxidant in the lungs. So N-Acetyl Cysteine, particularly if you're having any lung congestion, talk to your pharmacist about using N-Acetyl Cysteine. And again, specifically for COVID-19, this is just taking other data and putting it onto this. So with COVID-19, we look at the attenuation of influenza. So using N-Acetyl Cysteine can help decrease the duration of influenza symptoms, and it's also useful for patients with COPD. So the big people that I've been recommending this for, or the people who are at higher risk if they were to contract SARS-CoV-2 and COVID-19, is people who have COPD or have asthma. So I'm taking it right now, and it's something that if you're interested in adding a supplement, something that can be helpful. But again, talk to your pharmacist, particularly for people who have asthma or COPD. This can be a very, very helpful tool. And it is a much better alternative than Mucinex is. So think of it the same way as Mucinex, but with other properties that can be beneficial to supporting your immune system. So if you take Mucinex a lot, this is something to consider. Or if you're having any lung congestion, something to consider. Or if you're a high risk person looking for something that could potentially decrease your issues, something to consider. But again, just remember, there's always caveats with this. So its actions and dosages used in COPD management are debatable. So, but it's something that carries a low risk. So it's something that can be a very helpful tool. All right, and Tyler's sending me some questions, and I'll get to them here shortly. I just want to finish up. So elderberry is another one. I don't want to talk about the controversy too much, but there was a controversy with using elderberry that it could potentially induce cytokine storm by increasing tumor necrosis factor alpha. But this has basically been kind of thrown out. And as long as you're using elderberry not by itself in high doses, so how I like to use elderberry is combined with other products. These are kind of our go-to products with viruses that's got elderberry. When we talk about vitamin C, we talk about zinc, and Daily Immune are my two go-to with low dose elderberry, but can be a helpful tool for influenza for sure. And this is something I know all of my patients take on planes with them to prevent, decrease their likelihood of getting infection. But again, with COVID-19, we're not sure, but can be another helpful tool for you to talk about your pharmacist about. And my preference is always professional products that have other nutrients with it, so you're not getting a crazy high dose of elderberry. All right, we are getting towards the end, and I am past time, but that's all right because my dogs are sleeping now. So the question that I always get at the end then is, okay, JJ, what dietary supplements should I take? And I think you guys already know the answer. The answer is, it depends. So I'm like, all right, good work. But no, so the big thing is, if you're looking for dietary supplements, discuss with an open mind, doctor of pharmacy, or your healthcare practitioner. There's tons of healthcare practitioners in the Fox Valley that do a great job of helping people navigate these issues that, like us, are both in the traditional and functional world. And if you have a question on who that might be, reach out to me. I'd be happy to refer you to them. But it's something that there's medications are not the only option, but they can be a good option, just like dietary supplements. Anybody who kind of tosses dietary supplements to the side altogether really hasn't looked at the research at all, and they need to dig in a little bit deeper. So we need to use both tools, but talk to somebody who can help you navigate to find the tool with the highest leverage and the lowest risk. But so then the question is, most of these things are the things I've talked about. So the question I get, what dietary supplements have you used to support the immune system of your patients? And there's a lot of different things. And again, looking at the triage theory first, what we're missing. But the most things that have come up most recently when I go through my patient's profile, and again, it's not that people are taking all of these. There's just people who look at targeting these for certain people. So people not getting things from diet, a high quality multivitamin. My favorite few is Alpha Base by Orthomolecular, One or Pure Genomics by Pure Encapsulations. Mitocore is a multivitamin from Orthomolecular that also has N-Acetyl Cysteine in it. It's a great tool right now. Then looking increasing vitamin D3 plus K2. And vitamin D is one, if you're getting supplementing with vitamin D, particularly if you're getting the range of 2,000 to 5,000 IUs, you want to supplement with vitamin K2 as well. There's enzymes that are vitamin D and K2 dependent that you want to make sure that you are taking those two together, kind of like we talked about zinc and copper. N-acetyl cysteines are the big one. Vitamin C, you guys probably heard some of the headlines about using vitamin C IV. Theoretically might have helped some people. So increasing vitamin C is something I'm doing with a lot of people. And again, melatonin, not only for sleep, but for helping with our immune system. And again, we want to first look at how can we help our body produce our own melatonin. And then there's other things too, elderberry, immunoglobulin, mushroom extracts, and a bunch of other things, peptide therapies. But just know that these might be some tools. But before starting or stopping any of these, talk to your pharmacist, and we will go from there. So, and if you want to, if you follow me on my personal Facebook page, you don't need to do any of these things, but there are being weird is okay too. So never feel like because you're doing something that's right for yourself that you shouldn't do it because someone tells you not to do it. So a couple other things that are weird that if you want to take advantage of is number one, we do not sell these, but this has been a great tool for myself, my wife, and many patients is the chili pad. A lot of people is sleep disrupted because their body temperature gets too hot at night. So they go to bed fine, and then they wake up either sweating or having to go to the bathroom. Chili pad is a great tool for helping to regulate temperature at night. I put mine on one of the coldest settings. If you want to really nerd out, make sure you follow Dr. Mike T. Nelson. He talks about some theories with hibernating bears and the chili pad, but chili pad, look it up. Other thing is omega-3 fatty acids. So this was in October 2017. So no, I do not hoard these sardines, but these sardines are phenomenal. Eat sardines every morning. Ice baths, I don't want to talk about too much on why that's good, but don't do it if you're not used to cold temperatures, but that's me the other day. Some glasses, and then organ meats, eating some organ meats. My dogs love heart. So doing weird things is good too, but it doesn't mean, so the big thing is you don't need to do weird things to be healthy. It's taking a step in the right direction. And I do these things more as self-experimentation, something that I know if I'm recommending something to my patients, I want to make sure I try it myself first. So I'm never going to recommend a lifestyle change to my patients without doing it first. But if you guys like to nerd out on those things, give me a call. So actionable items. Number one, physical distancing. Most important. Number two, connect virtually with a loved one. So again, physical distancing does not imply social distancing. So it's something that you need to make sure we're maintaining these social connections. Super important for our immune system. Get some sunshine, preferably in the morning. So tomorrow morning, I challenge everybody, no matter if it's snowing, no matter if it's cloudy, get outside and go for a walk. I want to see everybody outside when I'm walking, but I want you to be at least a sidewalk away from me. And the other thing, if you're outside walking, be the first to take an action. If you see somebody down the block from you in the sidewalk, be the first to take an action. Walk across it, look for cars, walk across the street. You want to make sure that you are taking the action to help improve social distancing. And if you're a runner, you need to take the action before the person walking because you're moving a lot faster. Decrease blue light exposure at bedtime, wearing some blue blockers, having flux, increased movement. So looking at Oshkosh YMCA, Art and Fitness, those guys put us some awesome things for that. Hometown Pharmacy, we do as well, actually, too. So follow those pages. Take some time for yourself. Headspace is the one we love. My colleague, I love this quote, eat a vegetable. So no matter how many vegetables you ate today, after this, go eat one. Maybe I'll just stay on here live and just eat a head of lettuce right in front of you guys. I don't know. Eat a vegetable. I've got some of Rhonda Patrick's smoothie mixed up, actually thawing on my counter right now. And then it's the strategic use of dietary supplements. This is where you call your pharmacist. And if you guys kind of like my approach, like what I say, always feel free to reach out. I do personal wellness consultations, which we really go in depth, really get into the weeds of your specific goals and how we can improve your health, leveraging specific lifestyle strategies for yourself, specific dietary supplements for yourself. Give me a call, shoot me an email. These are scheduled out now about a month. I've got a waiting list on it, and because we're not doing face-to-face consultations, a lot of them are over media like this, but otherwise we could meet after it. But reach out to myself, reach out to the hometown pharmacist in your area. Be happy to help. I'm going to pick up my phone because I think Tyler has sent me some questions because I can't see the text. But so let me get these questions up here. But first of all, thank you guys all. If you guys have questions, shoot them in the comments below. And I'm going to start answering any questions that came in now, but most of the questions I already went through on this. So let's see. All right, so the first question that Tyler sent to me is, how long do supplements keep their potency after their expiration date, ... MCT oil. So specifically looking at MCT oil. So this is a really good question. So the first answer to this question is it depends on the dietary supplement company itself. So professional dietary supplement companies like orthomolecular and pure encapsulations will do testing so they know the potency of that product is guaranteed to be what's on the label until the expiration date. So it's something that with a lot of dietary supplements, I'm comfortable. Again, this will change from dietary supplement, using them a few months or a year even after the dating, but it's something that you want to make sure that the product that you're using has not gone bad. MCT oil is one. Any oils, fish oils and things after the expiration dating, it's something that probably shouldn't use it past it at all, and to be on the conservative side, to not use supplements past their expiration dating at all. I do personally for certain things, but MCT oil, I would go based off the expiration date on the bottle. And then the next questions is, where can we text questions on current supplements and or meds we are taking? We do have a text line set up within our computer software. We actually just got this to help open up our phone lines. Off the top of my head, I know our phone number. I do not know this, but what I can do, Tyler, or if Amber, if Kristen, Sarah, Brandon, and if any of you guys are watching, if you can respond to that with the number. I know it's a 920 number, but then you can send us a question, and I'll probably reach out to you with a phone call because it's usually easier to respond that way. But there is a text line. I don't have it off the top of my head, but I'll be sure to include it in the comments. And then the next question was Viracid in comparison to NAC or N-Acetyl Cysteine. So if we look at Viracid is a product I commonly recommend right now for people, and it's a product I commonly recommend during influenza season. So this is what they're talking about with Viracid. So Viracid has elderberry, it's got some vitamin C, it's got some zinc, it's got some vitamin A. So Viracid is one that we know for influenza, and for influenza works, and for some other viruses works well to shorten the duration of time that you're taking it. And it's something that I am currently taking right now, 2 capsules a day of Viracid along with the N-Acetyl Cysteine, because they have different ingredients in them. If you're going to take one or the other right now, if you are somebody who has COPD or asthma, in my opinion, N-Acetyl Cysteine right here would be the more important one to use. It's one that is a precursor to glutathione. And again, if you have COPD or asthma, we're more concerned about the lung issues. So it works as a mucolytic to help to decrease some of that mucus production. So particularly if you're having respiratory symptoms, N-Acetyl Cysteine is my go-to. If you're looking more for just a general immune support, 2 capsules of Viricid a day. And this is another one I love as well. The Daily Immune actually has some mushroom extracts and a few other things in it as well. But these 2 are great tools for that. So again, there's not a algorithm for this, and that's a great question. But it's something that talk to your pharmacist. If you have COPD or asthma, again, respiratory symptoms, N-acetylcysteine is your go-to. And you can use these 2 together. And I am currently right now, but again, what I'm doing is not necessarily the best for yourself. So talk to a pharmacist. Cool. And then Amber added the number on there, which is great. I see a thank you on here. Awesome. Well, I'll tell you what, I think, hey, Tyler, can you, is there any other questions on the chat line? If not, looks like we got, okay, and Amber added the text number in there. So if you guys have questions, text that number. But I think with that, I will wrap up. So I think, again, the most important thing here is if you have questions on lifestyle strategies or a headline, give your local pharmacist a call. All of my colleagues, same mindset as me, and they might have some different insights that I don't have. So give your local pharmacist a call, ask them about these strategies, ask them about which things you can leverage, and we'd be happy to help. And again, we don't, just to clarify, as pharmacists, we're some of the most accessible healthcare professionals. So as a doctor pharmacy, you can call me directly usually, and I can talk to you. So for just like general short conversation questions, I don't charge for that. But if we want to get more in depth and really get through the weeds, no matter if you're whatever your goal is, if your goal is increasing muscle mass because you're at risk for sarcopenia, if you have type 2 diabetes, and your doctor's threatening a medication, or not threatening, but the doctor say, hey, when you get the A1C down, or it might go on metformin, and you want a specific consultation with a specific goal, shoot me a message, shoot me a call. And I've got no more questions for today. So with that, tell you guys thank you. And the sun is out right now. So if you live over by Menominee Park, me and Marcus Aurelius and Moby Dick are going to be going out for a walk. So if you see me, wave at me, but don't get close to me. Otherwise, we will run away from you. All right. I'm going to try to stop this, but you guys all have a great day. And hopefully we will be able to see, high five, and hug, and fist bump, and hang out here shortly if I can figure out how to end. Okay. Here we go. See you guys.